I'm going to talk about anticoagulant rodenticides today. So I work at Lincoln Park Zoo in Chicago, in the Urban Wildlife Institute there. There's about 40 scientists at the zoo. So when I tell people I'm a scientist that focuses on rats and works at a zoo, people kind of look at me funny because like I could be studying lions, but rats are much more fascinating, as you all know. And within the Urban Wildlife Institute, I lead our One Health program. There's a small team of us that focus on that intersection between living with urban wildlife and public health. And in Chicago, we have the dubious honor of being considered the rattiest city in America for the past 9 consecutive years. A troubling title, but nobody really knows how many rats live in any city. So I'm not going to say that we have the most rats, but we do complain about rats the most out of any city in the United States. This is a little bit outdated, but back in 2021, you can see that we made over 60,000 rat complaints, more than double the amount made in New York. I have my own like pet theories about why we might complain about it more. For instance, in Chicago, we have alleys. So I wonder if, like, when you see a rat in your alley, you feel more like ownership of that rat compared to just a rat, around on the street. Um, but even if we don't have the most rats, it is a really big issue in the city, and issues have been growing over time. So it's a lot of controversy and a lot of public pressure to deal with the issues from the rats. And so, with that sort of rise in public interest and concern, I started the Chicago Rat Project in 2018 with just the overall goal of learning more about the rats in Chicago to prevent public health risks and also improve rat management. And we do that in two ways. One, we study the rat populations directly. We go out and trap rats in alleys. We look at trap success as a function of rat abundance. We collect organ samples to test them for different diseases. We collect tissues for genetic analysis. But we also talk to people using surveys and interviews to understand what people are experiencing when it comes to rats. And this work is really interdisciplinary, as all of rat work is. And so I just want to highlight the team right off the bat. We have a great team at Lincoln Park Zoo. We're also collaborating heavily with Dr. Kaylee Byers at Simon Fraser University, Danielle Germain at Johns Hopkins, Noe de la Sancha and Felix Crew at the Field Museum, and also Rebecca Fife at Landmark Pest Management, because you really can't understand rats if you don't talk to pest control professionals. And like Kaylee mentioned, we use a One Health approach that really emphasizes the interconnectedness between human health, animal health, and environmental health. All of our research questions sort of focus on the interconnectedness of the system. So Kaylee talked about the work we've done focusing on mental health by surveying people about, how often they see rats and how that affects their day-to-day life. We also focus on animal health by looking at the pathogens that rats are carrying. But today I'm going to focus on the environmental health component of this work, focusing on how managing rats, specifically using anticoagulant rodenticides, affects urban ecosystems. So, like many cities, rat management in Chicago is largely reactive. I don't work for the city, so I don't want to characterize everything that they do. But painting with a very broad brush, it is largely reactive and driven by public complaints. And so when people make a complaint about a rat sighting in their alley, um, or elsewhere in the city, they log it in their 311 program, and then municipal employees come out and they put rodenticide pellets down the burrow, like you can see in that image there. And typically they try to go out within the week, put it down the burrows, and then they paste a poster in the alley saying that they've come by to poison those burrows or treat those burrows. And so when we talk about anticoagulant rodenticides, they're products that you've probably seen before. It comes in the pelleted form. Often it's that bright teal color. Sometimes it's red, sometimes it's other colors. But you can also get bait blocks like they're in the middle, and those blocks are typically mounted in a bait station. So if you've walked around here in New York, you've probably already seen hundreds of those bait stations because they're basically outside every building. And the bait stations, the purpose of them is to exclude non-rat animals. Like, you don't want kids getting at the bait, you don't want dogs getting at the bait, you don't want other animals getting at it. It's also a really big industry. It's actually the most common way to manage rats around the world. And it's really appealing to people, right? Because you're putting this product out on the landscape. The rat eats it, the rat goes and dies somewhere. You don't have to deal with the dead body. You don't have to check the traps every day. Like, it takes a lot of time and effort to check rat traps. So putting out the rat poison is effective from a labor perspective and from a cost perspective. It's also a huge industry. It's projected to be a $1 billion industry in the United States alone by 2030. But the issue that I'm going to talk about today is that despite these benefits, rat poison has an enormous cost, and that cost is ecological because rat poison affects more than just the rats that consume the bait. Here, this graphic is showing sort of the chain of events where you put out rat poison in the bait station. The target animal, the rat or the mouse, consumes the bait. In an ideal scenario, consumes the bait and then it dies shortly afterwards. The issue is that whether it's alive or dead, the poisons stay in the tissue of the rodent that consumed that bait. So when animals like hawks or owls or other predators come and eat that animal, they are also consuming those toxic compounds. And as they eat more and more rodents, it accumulates in their tissues and leads to death of these non target animals. And over the past year, particularly, there's been a lot more public attention on this issue as there's been a couple of high profile urban owl deaths. Flacco, the sort of beloved eagle owl in New York City that had escaped from the zoo, collided with a building, and upon necropsy, they found rat poison in its system, which may have contributed to sort of that reduced mobility and the eventual collision. And then in Chicago, in Lincoln Park, so that's the park just adjacent to the zoo where I work, there was a family of great horned owls that people were sort of falling in love with because they were raising a baby owl, and it was also very nice. And then within the span of a month, the mom died, and then the baby died, and then eventually the father died. And so that really got people aware of how managing rats can affect other animals trying to make a living in the city. So how do they actually work? Well, by the name anticoagulant rodenticides, they are primarily anticoagulants, so they prevent blood clotting. And in the rodents, the goal is to cause like internal bleeding and then death. But that's also what happens to other animals that eat the bait. So they can no longer coagulate blood, you get internal bleeding, and then eventually you have animals that can show up at wildlife rehab, like bleeding from the nostrils, bleeding from the eyes, bleeding from the mouth. Um, it does that basically by messing with the cycling of vitamin K in the body. So when they don't have enough vitamin K, you can actually treat poisoning with vitamin K if you get to it soon enough. But often it's too late and it's untreatable. There's been a lot of work on this issue, and I'm not going to, belabor the point by going through a ton of studies. There was a great review done a few years ago that summarized 94 different species that it had been documented in. And I like this graphic because it shows sort of the wide range of organisms that anticoagulant rodenticides have been detected in. Even like earthworms and other invertebrates can pick up anticoagulant rodenticides from the soil. So they can get it from the soil. And then animals that eat invertebrates like birds or mammals, they can get it. And then it works up the food web to predators. And as I mentioned, sort of accumulates as they eat more and more prey. It can even get into aquatic systems. You see that little arrow going to the fish and then over to marine mammals. And just this year, there was the first report of anticoagulant rodenticides in amphibians. So it is showing up in like frogs and salamanders too. So how do these animals get exposed? There's a few different mechanisms by which animals can be exposed. Sort of the most obvious is primary exposure, when an animal sort of unintentionally gets access to the bait and eats it. Here's a photo of someone's pet dog that ate a bunch of rat poison, so they made it throw it up. So it's that like neon green color. In the middle, there's that barn owl I showed you earlier. So an animal that eats another animal that had been poisoned. So that's called secondary exposure. And then another way is through the mother. So people have demonstrated experimentally that the mother, if dosed with rodenticides, it can transfer to the fetus, but also through milk. So it can also go through the mom to the offspring. And as I mentioned with aquatic systems, there's also been demonstrated environmental contamination. So a recent study showed that sewer baiting can actually introduce anticoagulants into wastewater, and it doesn't actually get effectively removed in water treatment. And so they were able to pick it up in downstream effluent water and also in fish livers. And so there's a variety of routes by which animals can be exposed. You may have heard of different generations of anticoagulant rodenticides. Basically, they were first developed in the 40s and the 50s, with warfarin and difacinone being sort of the common ones. And the important thing there is that the early versions required multiple feedings to cause rodents to die. And that's because the body was pretty well able to sort of flush it out of the system through the liver. So they needed to eat it multiple times to sort of accumulate enough toxin. But then the 60s rolled around, and already they started seeing that rats were resistant to these poisons. And so in the 70s, another generation of rodenticides was developed that was more potent, takes much longer for the body to clear it from the system. And so this only requires one single feeding for rodents to die. The issue for other animals is that since these second generation rodenticides are so much more potent and they stick around longer, they're more able to accumulate in predator tissues. So they're much more problematic when we talk about biomagnification up the food web to top predators. And there's a lot of great work done on owls and eagles, like I mentioned, or larger predators like mountain lions, especially in California. But in our study in Chicago, we focused on mesopredators. Those are those smaller guys, raccoons, skunks, opossums. They could scavenge on dead rats. I don't think they're really going to go like hunt rats. They eat too much garbage for that. But they could scavenge on dead rats, and they use the same kinds of habitats that rats use. They're frequently in alleys, they're around the dumpsters. So these might be animals that could also just access the bait directly. Oh, and nobody's really looked into it because nobody really cares about garbage animals. And so in this study, our sort of main question was just how often are urban mesopredators exposed to rat poison? We also wanted to know how they get exposed. Like, are they eating the bait directly or is it some other way? And then we also looked at data in rats to compare the exposure in mesopredators compared to the target rodents. So this paper was just accepted like 2 weeks ago and published online. So if you want to read the whole thing, I encourage you 'cause it's a thrilling read. But that's really excited that it was just published. Okay, so this work was co-led by Jackie Buckley at the zoo, and she collected liver samples from carcasses that had been euthanized by pest control professionals in 2022. We got liver samples from 93 mesopredators, including 37 raccoons, 41 opossums, 15 skunks. In addition to those 93 adults, we also got livers from 4 opossum joeys, so the young, but I'll talk about them later. So we also analyzed liver samples from rats that have been trapped as part of a concurrent study. And so these rats were trapped in clusters of 4 blocks in each of 4 neighborhoods. And that study was looking at leptospirosis in rats and opportunities for transmission to people and dogs. And that was published earlier this year. But from those rats, we took their liver samples to look for exposure to rat poison. So here's a map of all the samples in the study. We tried to represent the urban gradient as best we could to test the prediction that animals closer to the city center, they might be more likely to be exposed to rat poison because there's more people there, there's probably more rats there, there's more garbage there. So we thought maybe we would see a spatial pattern in where they were exposed. Um, we did not find a spatial pattern because 100% of the animals that we sampled had been exposed to rodenticides. So I just want to pause here because it's easy to just sort of gloss over it and move on to other stats. But that's, I think, really important in and of itself that all along that urban gradient from downtown to the suburbs, not a single adult mesopredator didn't test positive for rodenticides. In terms of the number of compounds that they tested positive for, the majority of mesopredators tested positive for at least 3 different compounds. So that sort of suggests that they're exposed multiple times throughout their life and it's getting accumulated in their liver. Over on the right there, that's the data from the rats. So you can see that about a quarter of the rats tested negative for rodenticides. Um, And that's not necessarily surprising because the whole point is that the rats die, right? So you would expect that you would see lower exposure in animals where it's not accumulating, they're just dying from it. But I do think it's worth pointing out that 75% of the rats did have rodenticides in their system, but they were still alive, running around for us to test them or trap them. And so that sort of calls into question, like, well, are they getting a dose that's actually going to kill them? Are they surviving a long time after they're being poisoned? They can certainly be predated on by other animals in that time. So breaking it down in terms of like what specific rodenticides these animals were exposed to, these bars are colored by the species that we tested. And then I've grouped the rodenticides here into second generation over on the left, and then intermediate generation in the middle, and then first generation on the far right. And so you can see that sort of the most common ones are definitely that second generation that tend to stay in the body longer, and they're sort of used more often now. Particularly Brodifacoum and bromadiolone were the most common ones that we found. So that can sort of help us point to sources of where they got them. We haven't tracked that down yet, but I'll get into that a little bit later. We also looked at the concentrations of these compounds that were in these animals. And so we calculated what are called biomagnification factors. And that's simply just a ratio of the mean concentration in a predator compared to the mean concentration in the prey. And so a value of 1 just means that there was higher concentrations in the predator compared to the prey. But what we found was for Brodifacoum, which was the most common rodenticide that we found, the mesopredators had between 6 and 29 times higher concentrations compared to the rats. So that signifies that you're getting more accumulation over time and evidence that there's biomagnification happening as they just eat more and more, either more rodenticide or scavenging on rats that have been poisoned. So the question, yeah, how are they actually exposed? If you're squeamish, you might want to like look away for a minute. It's kind of gross, but I mean, we're all pretty into gross things, right? Like, you don't get into rats if you don't like gross stuff. So when we were taking the liver samples from the opossums, one of them did have that bright teal stomach contents. So that's a good indication that that opossum just directly ate rat bait, which they are not supposed to have access to, but obviously things happen. We also found that when we tested those 4 opossum joeys, that 3 out of the 4 tested positive for the same rodenticide that the mom tested positive for. And based on their appearance, the fact that they are lightly furred, but their eyes aren't open yet, we aged them about 6 to 7 weeks old, so they are not weaned yet. So the only food source they have is the milk from their mother. So this is the first sort of concrete evidence that urban wildlife are transferring rodenticides from the mother to the offspring before they're even, able to feed on their own yet. It can be kind of tricky to sort of interpret what exposure means for their health. Like if they have trace amounts in their system, is that actually negatively affecting their health? Or are they just testing positive? Um, so I did want to highlight that about a quarter of the skunks and a quarter of the opossums and a bit fewer of the raccoons, they had concentrations that exceeded those in other studies where those animals had signs of toxicity, like bleeding from the mouth or internal bleeding, things like that. And so that does suggest to us that, at least for a good proportion of the animals in our study, this is probably affecting their physiology and giving them signs of toxicity. Um, One thing that we don't have a good handle on is what the effects of eating or like being exposed to multiple compounds has on your body. Because I mentioned like the majority of the animals tested positive for at least 3 different kinds. We don't know if that just has like an additive effect or if there's like a synergistic effect that like multiplies together. We don't know, but it's a really interesting avenue for future research. But we do know, based on some really cool work in California, that exposure to rodenticides can affect animals' immune systems and cause immune dysfunction. This work's been done in mountain lions and bobcats, where they found that mountain lions and bobcats that had been exposed were more likely to have notoedric mange. So that's a disease caused by a mite that makes them lose their hair. And they later followed up that work with, an analysis of their immune function and found that um, you know, the effects on the immune system could make them more susceptible to infection. And I bring this up because raccoons, skunks, and opossums are really important species when we're thinking about zoonotic diseases. Like skunks are a good reservoir for rabies. They can all carry leptospirosis. Raccoons, of course, can carry raccoon roundworm. So these are not animals that we want to mess with their immune systems. Like when we're thinking of like a One Health system here, we want to be living with mesopredators that aren't carrying diseases. So if our management actions are making them more likely to carry the disease that harm us, this is also a public health issue. Um, I also wanted to touch on some work that we did at the same time where we took blood samples from free roaming cats that were undergoing a trap neuter release program. Um, about 7% of those cats tested positive, but this is sort of separate and different from the other work we did because we were taking blood samples. So it's a much shorter period of time when an animal would test positive compared to a liver sample where they like accumulate over like months or even years. So it's kind of like apples and oranges in terms of comparing the prevalence. But I do want to highlight it because in Chicago, there's what's called a Cats at Work program, where if people have rat problems, they can request feral cats to come sort of take care of their rat problem. But if we're putting cats out on the landscape to eat the rats, and we're also poisoning the rats, those things aren't very compatible. Like this is an actual issue for the cat welfare. I would rather like neither happen, but they're certainly incompatible with one another if we're thinking about the welfare of these cats on the landscape. Okay, so in terms of rat management, just to sum this part up, we found widespread exposure to rodenticides in raccoons, skunks, and opossums, with some having concentrations higher than poisoned animals in other studies. And we have evidence of biomagnification compared to the rats themselves. And I do want to emphasize again how like 3/4 of the rats that we trapped had rodenticides in their systems, and they could have been predated upon by owls, hawks, other animals. So it sort of undermines sort of like the efficacy of this management tool and highlights risks for other animals. So this would support recent restrictions in British Columbia, California, and other states to either ban second generation anticoagulant rodenticides or at least strengthen restrictions so that only licensed professionals can use them in very specific contexts. And it just emphasizes what we're all here to talk about, more sustainable rat management that is effective and minimizes risks over time, such as emphasizing sanitation, excluding rats from buildings. Of course, we're going to need to remove rats to lower their densities. But to do that in a way that is effective long term, we need to know more about rat ecology, and we certainly need to know more about human behavior. So I'm really glad that Chelsea highlighted that, because that's what I'm going to talk about next. Is how do we understand like why people use rodenticides in the first place, so that we can make management actions and messaging campaigns to maybe curb their use. So when we think about the reasons why people do what they do, one helpful framework is called the theory of planned behavior. And the theory of planned behavior posits that behaviors are preceded by intentions to do that behavior. And intentions are preceded by your attitudes, your norms. So, like, what are people around you doing? What do you feel like is expected of you? And perceived control over those actions. Like, do you feel like you can actually do what you want to do? And so in the case of rat poison, people's attitudes about rats, or maybe their ratitudes, are relevant here, but also their attitudes about rodent control. Like, do they think that poison is effective? Um, Norms could come into play in terms of like, do their neighbors use rat poison? Do their friends tell them to use rat poison? And then also, like, do they think that they even have the resources and the ability to control the rats on their property? Because as Kaylee highlighted, often when we talk to people, they do not feel in control of the situation and do not know what to do. So that might be coming into play too. So all of those together might lead someone to go out and put out the bait box. And you might think like, well, if so much poison is coming from municipalities or other agencies, like, why pick on just like the random resident who puts out rat poison? I want to pick on them because you can just buy it yourself. Like anybody can just go to Walmart. They have almost 100 products containing rodenticides. This is based on a web search that Kaylee's student Ryan Yazdani did. Uh, and when you just go out to Walmart and buy rat poison, you might not actually follow the directions, or you might just not be aware of how to do it properly. So you might end up with situations like this where someone just scattered rat pellets on the ground where any animal could be exposed. And I went to the EPA's website because I wanted to understand sort of like what's different between licensed professionals and just the general public. And one thing that's supposed to be different is that pelleted baits aren't supposed to be marketed for consumer markets anymore. So, like your general store where people just anybody can just come in and buy stuff. But I went over to walmart.com and see what I could find. And I found like a 20-pound bucket of pelleted bait that I could just buy and get shipped to my house. Oh, and it contains brodifacoum, which is the most common anticoagulant rodenticide we found in those mesopredators. And then I scrolled around some more and I found one that contains bromadiolone, which is the second most common rodenticide that we have found in our mesopredators. And I also find it a bit rude that it's like Hawk brand. Like, oof, it's like a low blow. Um, and then this third one, I mean, it has difascinone in it, which is okay, I guess, for the public to buy because it's not a second generation. But I wanted to highlight this one because under directions, it says can simply be left out for rodents to gnaw open. But like, that doesn't seem like very responsible use to me. So in terms of our study questions, we wanted to understand, what methods were perceived as being important by the public when it comes to managing rats. And we also wanted to know why some people were more likely to use rat poison than others. There might be a lot of factors that go into this, like their attitudes about rats, their perceptions of other wildlife. Like if they love wildlife, are they less likely to use poison? Is it something to do with their household? For instance, like if they have dogs or kids, are they more or less likely to use rat poison? And also socioeconomics, because these things aren't free. Like you might not have the disposable income to buy rodenticide products. And so we did a survey across 12 community areas in Chicago that we selected along an income gradient from the far north to the south side. We mailed out these postcards to random households. We got about 700 responses. The survey was available online, over the phone, or on paper in English, Spanish, and Mandarin Chinese. And when we asked them how important they perceive different management actions to be, um, the one that was the most often ranked as extremely important was actually cleaning up garbage, which I found pretty heartening, actually. Over 70% of survey respondents thought that cleaning up garbage was extremely important. And putting out rat poison was actually the least popular management action in terms of thinking that's extremely important. But 30% of people thought that it was extremely important. But those are the people that we're really interested in here in this study. And so in our survey, we asked a number of questions related to variables that we wanted to include in our analysis. So we built a model to predict like whether or not they used poison in the past 6 months. So that was just yes or no. And then we asked about like, did they think poison is important? How severe did they perceive their rat problem to be on their block? Their income level, whether they rented or owned their home, because if you're a renter, you might not even have control to do your own rodent control. Whether they lived in a house or an apartment, whether they had dogs or kids. And then we separately modeled as part of a path analysis whether they were more likely to think that poison was important based on their ratitudes, based on their concern about disease from rats, their values about urban wildlife, and their values about wildlife management. So here I have a path analysis diagram. And what I want to highlight here is that the arrows that are thicker show stronger relationships between different variables. And the ones with numbers that are bolded with asterisks, those are the ones that are statistically significant. And so a couple of things really pop out. One, pretty obvious, people are more likely to use poison if they think that poison is important. That's not surprising. What was surprising to me is that people were more likely to use poison and think that poison is important almost entirely based on their attitudes about rats. Like if they really hated rats or if they thought that they had a really severe problem, they were more likely to use poison and more likely to think that it's important. Their values about wildlife, no relationship really. Whether they had a dog or kids or their income, all of that was not important. It really came down to their perceptions about rats and rat problems. And so what I take away from this is how we talk about rats matters. Um, Here are two posters that are put out by the city of Chicago in an alley. I took this picture because I like to contrast the two posters. Like On the top, you have like a natural history illustration of a rat. It says like, don't feed the rats, and sort of, I think, a friendly font. It gives you some pointers for not providing food for rats unintentionally. And then on the bottom, you have sort of like warning rats. This rat looks like it has rabies to Kaylee's things about rabies. It has sort of a snarl. It's got glowing red eyes. It's got like a target on it. Those are very two different approaches to talking about rats, right? I feel like the top one, a little bit friendlier, I guess, a little bit less like rats are our enemy. The bottom is definitely more eye grabbing, but it also, I think, elicits more fear. And I think it's the fear mongering that might lead to people sort of doing whatever it takes to manage rats, and that includes rat poison. So I would emphasize instead, fact-based messaging is great. Messaging that emphasizes, how to reduce risks from rats rather than just being scared of rats. Um, Messaging that also emphasizes the risks of using rodenticides, because currently a lot of the messaging is about what rats will do to us and not what rat management does to other things. We don't really think about that or talk about it. Um, Also pointers like, if you are going to use rat poison, what are the proper ways to use it? Because people might not read the container very carefully. And also suggestions for alternative methods. Like, rather than just using rodenticide, what are other things that people can do to manage rats? And so I like this graphic from the CDC on steps to how to safely remove a rodent from a trap. I like it for a couple of reasons. One, because it's very tone neutral. It's not trying to make you any more scared than you already are. If anything, it makes people feel empowered. It seems like you can do it. You could do it by yourself. Here's how you do it safely. But it does emphasize risks, and it emphasizes what you can do to reduce those risks rather than just making people feel helpless or scared or like they just need to go out and win this war. These are simple steps that you can take. In terms of the impacts on wildlife, I was a bit surprised that people's values about wildlife didn't really bear into whether they used rodenticides. And I think it comes down to awareness. There was a great study done a while ago in Southern California looking at people's rodent control behaviors. And they found that people had pretty low awareness that rodenticides affected wildlife. So that might be the disconnect between actually knowing that what you're doing is affecting wildlife. So there's a lot of, good messaging out there, but it's largely from wildlife rehab centers. And they're sort of like targeting people who already are obsessed with wildlife. So sort of factoring in this kind of messaging in rat messaging broadly might really help people think twice before they just sort of scatter rat pellets around their yard. So where do we go from here? Like, here's a lot of problems, but what do we do about it? So in Chicago, I'm a part of the Chicago Bird Alliance Rodenticide Task Force. Um, this task force was inspired by the deaths of the great horned owls in Lincoln Park. And so I chair their research subcommittee. Um, they also have a subcommittee for communications and community engagement, and a subcommittee for communicating with public officials. So the research team was tasked with drafting policy recommendations. And we're also evaluating a pilot project for contraceptive pellets for rats called Good Bites. And our policy recommendations are pretty straightforward. It's basically, allocating funds, information, education, and collaborations for things other than rodenticides. Try to like whittle away at the city's budget for rodenticides and allocate it to other things. Like, for instance, the city does use dry ice and, by extension, carbon dioxide to fumigate rats out of burrows. Other cities have had good luck also with carbon monoxide fumigation. As I said, we're piloting contraceptive pellets. Contraception, it definitely needs more research, but at least it addresses the problem of sort of the exponential growth of rodents rather than trying to kill something that reproduces exponentially. So it's worth looking into more. But of course, the bedrock of all of this is really waste management, right? Like, if we're just having this endless buffet, we're never going to get a handle on it. So a lot of what we talk about is about waste management. In Chicago, you can request that your garbage can gets replaced we suggest, well, the sanitation workers know which garbage cans need to get replaced. Maybe that could be automatic instead of relying on people to do it. Or more just proactive actions like going out where there are alleys with garbage issues, proactively cleaning those up, making rodent proof cans, those kinds of things. The next phase of the Chicago Rat Project is focusing on rats in community gardens. I bring this up here because community gardens are an area where rat control can be quite tricky because they're places where people are growing food, right? So people often feel very uncomfortable using rat poison because it can, get in the soil and things like that. So we are putting on workshops to help gardeners learn how to snap trap rats and fumigate their rats. I've heard about, rats in community gardens in New York, so I'd like to talk more about that with folks. We did a survey of community gardeners and found that 40% are concerned about getting sick from rats in their garden, and 14% actually spent less time gardening because of the rats, largely because they feel scared and because they're concerned about food safety. So this is sort of what we're focusing on now, how to mitigate those problems. So to sum up, we found widespread exposure in urban mesopredators to rodent poison. And we found that the majority of rats, even when we trapped them, had rat poison in their system, so they could have been predated upon by other animals. We found that using rat poison was associated with having really negative attitudes about rats and not a ton of other factors. So I would say that how we talk about rats matters. We want to have evidence-based, tone-neutral messaging, and we need support for alternative methods. Before I cede my time, it's not often that we have this many rat nerds in a room. So I wanted to put out a plug for an urban rat research coordination network. The NSF has funding for these coordination networks to fund meetings and collaboration opportunities that can be international. The budget's like 500K, so it could help fund some pretty cool meetings. So if anyone's interested, please do get in touch with me because I'd love to put something together. And with that, I'll thank you and have a great lunch.